The heart monitor goes flat. The continuous tone fills the room. The doctors have tried everything. CPR, defibrillation, medications. Nothing works. After 20 minutes of failed resuscitation, they call it. Time of death, 9:47 p.m. The doctor removes his gloves. The family is called in to say goodbye. The body lies still under a white sheet. No pulse, no breathing, no brain activity. And then, 10 minutes later, the chest moves, the eyes open, the person sits up. They came back from the dead, not in a religious sense, in a medical one. And it happens more often than you think. This is called Lazarus Syndrome. And what's happening inside the body during those minutes after death is something that's rewriting what we know about life, death, and the line between them. The year is 1982. A 65-year-old man in Pennsylvania suffers a massive heart attack in the emergency room. His heart stops. The medical team rushes to save him. CPR, chest compressions, defibrillation, the electric paddles trying to shock his heart back to life. Epinephrine injected directly into his veins. They work on him for 25 minutes. Nothing. His pupils are fixed and dilated, a sign of brain death. His skin is already turning pale and cool. The lead physician makes the hardest call in medicine. Time of death, 3:15 p.m. We did everything we could. The team begins to disconnect the equipment. They cover the body. The doctor steps out to inform the family. 10 minutes pass. Then a nurse who stayed behind to clean up hears something, a gasp. She pulls back the sheet and screams. The man is breathing. His eyes are open. His heart is beating, not just beating, but beating at 90 beats per minute, normal rhythm. The doctor runs back in. He can't believe what he's seeing. The man who was dead 10 minutes ago is now asking what happened. This was the first documented case of Lazarus Syndrome, and it opened up a mystery that we're still trying to solve today.
So what's actually happening inside the body? How can someone be dead, medically, legally dead, and then spontaneously come back to life? Here's what we know. When your heart stops, doctors perform CPR, cardiopulmonary resuscitation. They're manually pumping your heart and forcing air into your lungs. Every compression pushes blood through your body. Every breath forces oxygen into your system. But it's not perfect. They're generating maybe 30–40% of your normal blood flow. And here's the critical part. During CPR, pressure builds up in your chest, blood accumulates, air gets trapped in your lungs. The more they compress your chest, the more pressure builds. Think of it like this. Imagine compressing a sponge underwater repeatedly. The sponge absorbs water. When you stop compressing, the water doesn't immediately leave, it's trapped inside. Your chest is that sponge. During CPR, pressure keeps building. When the doctors stop CPR and declare you dead, that pressure is still there. Your chest is compressed, your blood vessels are constricted, and then slowly that pressure releases. Your chest cavity expands, your blood vessels relax, and suddenly blood that was trapped starts flowing again. This is called auto-resuscitation, or the Lazarus phenomenon. The delayed release of intrathoracic pressure creates a spontaneous return of circulation. But here's what makes it so dangerous and unpredictable. We don't know when it will happen. Sometimes it's 30 seconds after stopping CPR. Sometimes it's 10 minutes. The longest recorded case was 17 minutes after pronouncing death. And we don't know who it will happen to. There's no way to predict it, no test, no indicator. You can have two identical patients with identical cardiac arrests, and one experiences Lazarus syndrome and the other doesn't. The current theory involves several factors working together: the trapped air in the lungs creating positive pressure, hyperinflation of the chest from aggressive CPR, high doses of epinephrine that were given during resuscitation finally reaching the heart after circulation returns, and dynamic hyperinflation in patients with chronic lung disease. But the truth is, we don't fully understand it, and that's terrifying, because it means we might be declaring people dead who aren't actually dead yet.
Let me tell you about another case. 2001, a 45-year-old woman in Australia suffers cardiac arrest. The trauma team works on her for 40 minutes. 40 minutes of continuous CPR, multiple shocks from the defibrillator, 3 rounds of cardiac medications. Nothing works. They pronounce her dead. They move her body to a quiet room so the family can have privacy to say goodbye. 7 minutes later, a nurse comes to check on the family. The woman is sitting up in bed, talking, asking for water. She had no memory of being dead, no tunnel of light, no out-of-body experience. One moment she felt chest pain, the next moment she woke up confused in a hospital room with her crying family around her. She made a full recovery, no brain damage, no heart damage. She lived another 15 years before dying of unrelated causes. Then there's the case from 2014. A 78-year-old man in Poland declared dead after 40 minutes of failed resuscitation, moved to the morgue. 5 hours later, 5 hours, a morgue worker opened the body bag to begin preparation for autopsy. The man was breathing. He woke up in a morgue refrigerator, confused, freezing, but alive. By 2023, there have been 63 documented cases of Lazarus Syndrome in medical literature, but doctors believe the real number is much higher. Why? Because many cases go unreported. Imagine you're a doctor. You just declared someone dead, then they come back to life. That's not just medically baffling, it's legally complicated. Some doctors worry about lawsuits, others worry about their professional reputation, so cases go unreported. But there's a pattern in the documented cases. Most happen within 10 minutes of stopping CPR. Most involve aggressive CPR for extended periods, usually 25 minutes or more. Most involve high doses of epinephrine, and many involve patients with chronic lung disease like COPD or asthma. This tells us something important about the physiology. It's not magic, it's not supernatural, it's delayed effects of medical intervention combined with pressure mechanics in the chest.
So here's the big question. How long should doctors wait before declaring death? Current protocols say that after you've tried everything and there's no response for several minutes, you can pronounce death. But Lazarus Syndrome shows us that dead might not mean what we thought it meant. Some experts now recommend waiting at least 10 minutes after stopping CPR before declaring death, just watching, monitoring, because that's when most Lazarus events happen. But imagine being a doctor in that situation. The family is waiting. You've worked on this patient for half an hour. Every instinct tells you they're gone. But you have to wait 10 more minutes just watching a corpse in case they spontaneously come back to life. It's psychologically exhausting. It's emotionally difficult, but it might be necessary. There's another implication that's even more disturbing. How many organ donors experienced Lazarus Syndrome after their organs were harvested? The protocol for organ donation requires cardiac death to be declared, but if some patients could auto-resuscitate 10-15 minutes later and were harvesting organs at 5 minutes, you see the ethical problem. This has led to new guidelines in many countries, longer waiting periods, more careful monitoring, because the line between death and life turns out to be much blurrier than we thought.
Lazarus Syndrome teaches us something humbling. We don't understand death as well as we think we do. The boundary between alive and dead isn't a clear line. It's a gray zone, a transition period where the body might still have one more restart left in it. And this changes everything. It changes when we pronounce death. It changes when we harvest organs. It changes how we think about the final moments of life. If you ever wondered whether miracles exist, maybe they do. Not supernatural ones, but physiological ones. The miracle of pressure mechanics, the miracle of delayed drug effects, the miracle of the human body's incredible resilience. The next time you hear a story about someone coming back from the dead, don't dismiss it as religious myth. It might be Lazarus Syndrome, and it might be teaching us that death isn't the end we thought it was, at least not immediately. Comment if you've heard of a Lazarus case. Subscribe for more medical mysteries explained.